Hi there, it's Dr. Porter from WrinkleFree. I'm the Med Spa and Wellness Clinic in Austin, and I wanted to talk to you today about the O shot. So, as you know, we've been doing O shots here for almost 2 years. Recently, I went down to Alabama and trained with Dr. Reynolds to become a trainer. So I'm going to be training other physicians, nurse practitioners and PAs from around the country in the procedure. I believe in it. I've had it personally. It really changed my life after my 4 children and all the pain that I had with intercourse. And so I want to talk about it real briefly and how it might help you or a friend of yours, your sister, somebody else. So orgasm shot, we call it the O shot, and what it really helps with is libido, stress urinary incontinence. It can help with the breast cancer, dryness after breast cancer treatment, anorgasmia we call that, which is decreased ability to orgasm, this urge urinary incontinence where you feel like you have to go and you're not going to be able to make it to the bathroom. Lichen sclerosis and lichen planus are inflammatory conditions that I've personally treated with the O shot. And then fecal incontinence after a baby, chronic pain, episiotomy scars, pain from mesh, and then this is a cool one, interstitial cystitis, which is a chronic bladder inflammation. So there was some research on breast cancer patients and survivors, and we're about to be in October, which is Breast Cancer Awareness Month. So I wanted to bring this to your attention. This is a study called Efficacy of Injecting Platelet Concentrate Combined with Hyaluronic Acid for the treatment of vulvovaginal atrophy in postmenopausal women with history of breast cancer. Holy crap, that's a lot of words. What does that mean? That means how well did it work when we injected platelet-rich plasma. In this case, it was combined with hyaluronic acid to activate it. You can activate it with hyaluronic acid or you can activate it with calcium chloride, which is what we do, for the treatment of vulvovaginal atrophy, which means the vulva or the external, like the labia, the outside of what we call the vagina. The vagina is really just an internal organ. Atrophy means just getting kind of less healthy, so drier, thinner, and kind of suffering changes after, a lot of times it's after babies, or in this case it would be after breast cancer. That could either be from menopause or the breast cancer, also the radiation and chemo, that can all cause you to have menopause. It can cause your ovaries to shut down, which is basically what menopause is. There's lots of different reasons why people can have vulvovaginal atrophy, and this is specific to breast cancer, but any kind of cancer really, or somebody that's had surgical menopause, like a young woman that had to have her ovaries taken out because she had endometriosis and it was all over her ovaries. We have some of those patients too. We try to get them on bio-T hormones, and that's a great combination. We're happy to talk to you about that as well. But basically this is saying that about half to almost 3/4 of breast cancer survivors have symptoms of vulvovaginal atrophy. So the problem is that if you've had breast cancer, you can't get estrogen. So that's what makes things dry, and we can't replace it with bio-T, because if you have an estrogen receptor positive breast cancer, then if we give you estrogen, we can increase your risk of that breast cancer recurring. So we can't give them estrogen. We can give testosterone, but not estrogen. And so then they have painful intercourse. It hurts, it burns, maybe it's just dry all the time. They get chronic UTIs, they could get bacterial vaginosis, yeast infections, stress urinary incontinence as a result of the tissue not being as full as what it otherwise would be. And so this basically study checked, it's a small study, but 20 women, and they did some scoring on them, what their pH of their vagina was, how elastic it was, how many secretions they made, how intact their skin was, and then how moist it was. And they basically did these treatments and then evaluated the women afterward. And what they found is that every single participant, all 20 women, showed improvement in their clinical symptoms, and it was highest at 6 months afterward. So basically this is a great treatment to help women that are having painful intercourse for whatever reason, especially after cancer. And I want to show how the O shot kind of works. So it's a series of 2 injections. One is going to be external in the clitoris, and the second one is going to be in the vagina, and there are these glands called the Skene's glands, and what they do is they submit the moisture that causes lubrication. It's sort of like a man has a prostate, and then they have secretions that go into their seminal fluid. So the second O shot, here's your little urethral opening, which is your pee hole, and then here's your opening of your vagina, and then your vagina. So the second injection that we do actually goes in here, and it bathes these glands with something called platelet-rich plasma, which is basically your own blood that's spun down into this yellow goo, and when you inject it and you activate it, it simulates that there's an injury, and it calls all your stem cells into your body to help rebuild and regenerate tissue. So that's really what we're doing. Anyway, we hate people that have breast cancer that have problems afterward. That's so sad. I hate when women have pain and they're 35 because they've had children and it's hurting them. Sex is supposed to be fun. It shouldn't be painful. But what I love is to help people. So if you know somebody or you're suffering yourself, give us a call and click on our thing and come see if an O-Shot's right for you.